Hello everybody, Dr. Shadi Ireifej here, board certified surgeon, chief of specialty, and part owner of TrueCare for Pets in Studio City, Los Angeles, California. Thank you so much for listening into our podcast today. We're going to be talking about a disease entity, mostly focusing on dogs, that is very common if you've ever owned any dogs, and especially if you own purebred dogs, German Shepherds and what have you. Hip dysplasia. Very, very common disease. Ranges from anywhere to mild to really debilitating. And it is a complex condition. I certainly don't expect to review all these very, very specific nuances of this disease, but it is something that people inquire about. And hip dysplasia is one of the most common diseases that I will see as an orthopedic surgeon. And as a family veterinarian, your family vet, I'm sure they get a handful of cases a week based on hip dysplasia. And so we're going to talk about it. We'll go over the disease itself, what causes it, what it means, how to diagnose it, and then we'll talk about some treatment options. And we're going to be focusing on dogs. It does happen in cats, I think, but it seems to me that it's very sporadic in cats. Cats are also much more subtle about showing signs of hip dysplasia, and the research is not very strong on cats with hip dysplasia as well. And I think usually a dysplastic hip in a cat probably resulted from trauma, which is not the case in dogs. And so we're going to focus the discussion on dogs. Just be aware that in theory, any of these mammals with hips can potentially get hip dysplasia, I suppose. It's just one of those things that it's most described in dogs. So canine hip dysplasia. The hip joint, of course, is what attaches the pelvis to the rear legs, to the hind legs. It's made up of the acetabulum, which is a concave portion of bone that's part of the pelvis. It holds within it the femoral head. The femoral head is attached to the femur, which is your thigh bone. And what keeps the femoral head in the acetabulum, that is in fact the hip joint, is there are several factors. There's a ligament called the ligament of the femoral head that attaches from the center of the femoral head to, roughly speaking, the center of the acetabulum. It's a very strong ligament, and that's one of the main ways your hip joint stays in place. There's also the actual coverage of the acetabulum over the femur. So if you imagine the acetabulum being like a cereal bowl, and you put your fist in the cereal bowl, that's basically what it is. Your fist is the femoral head, and between your fist and the bottom of the cereal bowl is where the ligament would attach. Then there's a joint capsule, which attaches on the acetabulum onto the femur, the femoral head, femoral neck, and that joint capsule is what keeps the joint tight. There's also joint fluid, which provides cohesive forces between the femoral head and the acetabulum, and that creates almost like a suction cup effect, which helps hold the hip in place. And then there's the muscles, the thigh muscles that are that are attached in many different areas between the pelvis and the femur that help, of course, keep the hip stabilized. And these stabilizing forces are what keep the hip in place. The only way a dog's hip can form normally is if the femur, the femoral head, constantly pushes on the acetabulum as the dog is growing, both in utero, in the mom, and after birth. If the femoral head never makes contact with the acetabulum because they're born with a defect or because it has sustained some kind of a trauma, well, then the acetabulum won't form that deep cereal bowl effect. And so the hip joint will never form correctly. And then the femur will not sit in the acetabulum, which means that you have a abnormal or a dysplastic hip. So that's how you develop that concave appearance to the acetabulum. You need the forces that I just mentioned to contact the acetabulum to create a depth to it to form a hip joint. So now you have a dog with a hip joint. And the question still is, well, what causes dysplasia? Because that normal formation of the hip joint is just an explanation of how it forms. But hip dysplasia itself, what actually causes it? By definition, a chronic subluxation of the hip joint leads to dysplasia. Subluxation is, if you ever had a luxated hip or a luxated elbow or a luxated shoulder, what luxation implies is that the bone itself, the two bones that make up that joint, are no longer in contact with each other. So if you luxated your hip, then your hip bone, your femur, is popped out of its socket, basically, right? That's layman's terms for luxation. If you have subluxation, that implies there's a dynamic principle to this. That implies that the joint itself is no longer tight. If you don't have a tight joint, the portions of bone that make up that joint continuously pop in and out of the socket repeatedly, in and out, in and out, in and out. Those are forces that are not conducive to normal joint health. It'll create pain and limping in the individual who's affected. It'll create secondary changes to the joint. You'll get inflammation, swelling. Over time, you'll get scar tissue and arthritis. And so subluxation is a constant, almost pistoling of the bone and the joint supposed to be sitting in. And so in this case, the femur, the femoral head, will constantly jump in and out of the socket or the acetabulum. And why dogs have this inherent laxity in their hip, we still don't know. There are thousands of medical papers on this. There are some strong genetic basis for this, where some dogs just in their genes, and they have alleles on their genes, which are segments of genetic code on a chromosome, that encode for subluxation of the hip. And you end up with a hip joint that's not normal. The motion is not normal, and they're born that way. There are some that maybe are traumatic. Maybe in utero, they're traumatized, or maybe during the birthing process, they're traumatized. And there's some sort of permanent damage. Now the hip is no longer as tight as it should be. There may be nutritional factors. If you feed your young large breed dog too much calcium or too much protein, maybe the rate at which they grow or the roughness by which they play is creating instability in that hip joint, leading to dysplasia. There are many, many other reasons or hypotheses as to why hip dysplasia occurs. At the end of the day, the outcome in hip dysplastic canines is the same. The hip joint is not tight. You have a constant pistoling of the socket, resulting in pain, inflammation, and over time, scar tissue and arthritis. And so over time, when you have this laxity in the joint becomes malformed, right? It no longer can sustain the normal anatomy that is considered ideal or normal. So you end up with a joint that's malformed. It has to get used to the trauma it's sustaining. You've got a loose joint. The body's going to do whatever it can to make sure that joint can function as close to normal as possible. So it undergoes transformation. You end up with a widened femoral head, wide femoral neck. You end up with sclerosis, which is increased bone deposits on the bone itself. You end up with a joint capsule that stretches out or develops scar tissue. You end up with a ligament of the femoral head that's now lax. It's got inflammation in it. It no longer is doing its job to the best of its ability. You end up with an acetabulum that ends up being flatter than normal. You don't have that deep socket feel to it anymore. Now it's kind of like a flat dish instead of a cereal bowl. And so it's no longer able to capture the femoral head. It can't keep the socket in place. So over time, it develops these characteristics, and that is what a dysplastic hip looks like. It's a malformed joint. It's just not normal. And there's the severity ranges. It could be anywhere from mild, moderate, severe, or end stage. And that's how the body has to grow accustomed to the abnormality that it's born with or that it's sustained. We tend to see hip dysplasia or think of it in terms of the larger breed dogs. Larger breed being, 30, 40 pounds and above maybe. It depends. But the Golden Retrievers, the German Shepherds, Great Danes, Dobermans, these larger dogs are the ones that we see that have hip dysplasia. But then when you go into the smaller dogs, Yorkies, Maltese, these types of sort of petite animals, they can also develop dysplastic hips, and we're not sure that pathogenesis, or rather the cause of the dysplasia, is the same in every breed. It probably isn't. And then you have dogs that are bred to be kind of short and sort of squat. So like bulldogs, for example, they have that bow-leggedness to them. We like that look. That's why they breed them that way. They're really adorable. And the problem with that, with breeding them that way, is they develop many, many issues. One of which, of course, is hip dysplasia. But they also have kind of a weird form of dysplasia. It's not really dysplasia from the classic sense. They have they have hips that never even really touch each other. And so they never form that normal ball and socket joint. And so the point of this isn't really to nitpick every single breed and what causes it in every single breed, although we'd like to know that information. It's really just to explain to you that hip dysplasia can happen in any breed dog. You tend to see it more with the larger breeds. And we don't really know what causes it, but it certainly is something that we think it starts at a young age. Now, how do you diagnose the disease? Well, you first diagnose as a veterinarian based on the clinical signs and history. So you have a dog that is limping in the hind legs. You have a dog that's refusing to jump on furniture or going up and down stairs. You can tell they want to, but they seem to refuse to. And if you have a young, active, large breed dog, those are the kind of dogs that really should be like running a mile a minute. They should be jumping all over the place and jumping on you and furniture and using stairs and catching balls. And if they're not doing that stuff, that's a sign that maybe your dog has hip dysplasia. You might see limping in one leg. You might see difficulty walking in one leg or both legs. You'll certainly will get hip pain. You'll end up losing muscle mass in the affected leg, so you'll get muscle atrophy. One leg will look skinnier than the other. Your veterinarian will then do their examination. They'll find discomfort upon palpation of the hip. They'll be able to feel arthritis to some degree, kind of like a crunching sound. It's called crepitus. We'll palpate that on the physical exam. They'll notice the muscle loss on one side. And you, as a pet owner, may not notice muscle loss because of hair, right? The dogs are much hairier, of course, than we are, and so you really can't see it. But when you actually put your hands around the girth of the thighs, you'll notice that there's asymmetry there. The veterinarian will go through range of motion of the hip and find there's limited range of motion. There's pain with extension of the hip or with abduction of the hip. And they'll watch your dog walk around, and they'll look for kind of maybe a short strided gait or a limping in the hind legs. And then, of course, that's a suspicion that your dog has hip dysplasia that does not confirm it. And so you have to run tests. And by far, the most common tests to perform are x-rays, also known as radiographs. Pelvic x-rays will determine whether or not your dog has hip dysplasia, how severe is it, and will also determine treatment options for it. There are plenty of studies that look into other different tests, CAT scan, MRI, scintigraphy. There are many, many different tests, and scoping of the hip, arthroscopy. But by far, the most common first line of defense is going to be x-rays. The manner by which you collect your x-rays, what position the pet is in, whether they should be awake or sedated, all that is information that is very, very complex and surrounded in opinion from veterinarian to veterinarian, and not something that we're going to go through with this podcast. But your veterinarian, as long as they're experienced and they've been doing this for some time, they'll pick whatever technique they think is best. They have your best intentions in mind, and they'll position your pet however they want to position them for the x-ray. They'll recommend sedation if they want sedation, and they'll get the different views. They'll review them. They'll have the specialists review them, or they'll send out to a radiologist to review. You can send it to me as a surgeon. I'll review them, and they'll tell you what they think. So to diagnose hip dysplasia, you're looking at the clinical signs, so what your pet is showing at home. You're looking at your veterinarian's palpation during physical exam findings, and then, of course, x-rays. And then you go from there. It may be very difficult for your veterinarian to characterize hip dysplasia versus any other hip trauma. Any malformed hip you can blame as being dysplastic. But if we believe that hip dysplasia starts at a young age, and you're diagnosing it in a 12-year-old dog who just started showing signs, that may not be the whole story as to why the hips are malformed. Or maybe the hips are not the problem. Maybe the hips have always been that way. They've always been dysplastic, but there's a lower back issue now. So it is not to say that every malformed hip is dysplastic. Also, hip dysplasia tends to be bilateral. It affects both hind legs. Most congenital diseases, most genetic diseases, most developmental disorders tend to be somewhat symmetric, affecting both sides equally. Or if they're not equally affected, you're still being affected on both sides. We do see unilateral hip dysplasia, which is hip dysplasia in only one hip. That does happen. We do see that. And I think I see that more with the smaller breed dogs and cats than I do with the medium and large breed dogs. So when we use the word dysplasia, we are describing a malformed hip with the cause being subluxation of the hip that resulted in malformation of the hip joint. But we can't tell that with 100% certainty with every single case because every case is different. And hip dysplasia is a very complex developmental disorder. So you have a dog with hip pain. They're showing signs at home. You go to your veterinarian. They suspect there's hip disease. They do the x-rays. You got hip dysplasia of whatever severity. Maybe it's both sides. Maybe it's one side. but they determined that hip dysplasia is your dog's problem, and so what are some treatment options? And this, again, is an hour-long discussion by itself, but I will keep it short and sweet so that if you as a pet owner is listening to this podcast, you can go to your veterinarian at least more well-informed than you were before listening to this. You've got medical management, you've got surgical management. Those are your two categories. And of course, the two can overlap. Medical management is focused on trying to alleviate your pet's symptoms. And rather, I shouldn't say symptoms. Symptoms are a term used in human medicine and requires that the patient themselves complain about the problem, which obviously is impossible for animals because they can't talk. So we, instead of saying symptoms, we say clinical signs. So depending on the clinical signs of your pet, they're going to give you medical management option, which is analgesics, so morphine type drugs, nerve desensitizing type drugs, anti-inflammatories, which are huge, mostly non-steroidal anti-inflammatories. They're going to give you those medications to help with pain, swelling, discomfort, arthritis in the meantime. They're also going to look into long term. They're going to want you to try and keep that joint as healthy as possible. So they're going to give you glucosamine chondroitin, which is the joint supplement. They're also going to give you fish oil supplement, which has omega fatty acids in them. That also helps with joint health. They're also going to recommend that you find other ways of keeping the joint healthy, which can include acupuncture, physical therapy, herbal medicine, weight loss. Those aspects are huge. And really what most pets are going to receive or what we're going to recommend to you as veterinarians is a combination of all those things. They're going to give you medications to help with pain and inflammation. They're going to give you medications to help with the joint health. And we're going to make lifestyle recommendations to try and keep the muscles strong, keep the range of motion healthy, keep your dog nice and lean. That's the medical management route for the most part. It's going to vary depending on what your veterinarian wants. Then you've got surgical management, and there are many, many different surgical interventions for hip dysplasia. I would say probably the two most common that you'll hear about are total hip replacements. Yes, we do total hip replacements in dogs and cats, or the femoral head and neck ostectomy, also known as the FHO. The total hip replacement is fantastic. It's what they do in people. They basically take out the diseased joint and replace it with a false joint. It is as close to normal anatomy as you're going to get in your dysplastic dog. It's not done by every surgeon. There's a large learning curve with total hip replacements, and not every dog is a candidate for the procedure. It's also the most expensive procedure in terms of these two options. But it's as close to a normal joint as you're going to get, as long as there aren't any complications. The surgery itself has a fantastic outcome. They can do really well with it. And those implants are meant to stay in there for life. Obviously, I'm glossing over a lot of the intricacies of this procedure, but I want you to be aware that total hip replacement is an option for your pet. The second most common surgery, or I should say the other more common surgery, is a femoral head and neck ostectomy, FHO. So femoral head and neck, we already spoke about the anatomy of the femoral head and the femoral neck. That's what attaches the hip joint with the acetabulum. Femoral head and neck ostectomy. Ostectomy is removal of bone. So you're literally removing the hip joint. You're removing the femoral head and femoral neck. And then you think to yourself, well, what replaces that? Well, the surgeon will reconstruct a joint capsule, right? We talked about that as being one of the major stabilizing structures of the hip joint. And the surgeon will also reconstruct the muscles, which we also talked about as being a very important factor in keeping a hip joint stable. And the dog will form what's called a pseudo joint or a false joint. So although you won't have the normal range of motion that you had before, although this is not as good as having a normal healthy joint, obviously, it is a manner by which you can remove the pain by taking away the bone that is constantly subluxating against the acetabulum. And by getting rid of the bone, you can eliminate arthritis. It's no longer a problem because there's no joint there anymore. And your pet can now, through rehab, time, medications, weight loss, etc., have a pain-free hip. The range of motion that we know is abnormal after an FHO procedure doesn't seem to affect their quality of life at home. In fact, they do very, very well. A veterinarian can tell that the hip was tampered with because there will be abnormal range of motion. And we know that from practical experience as well as the medical studies. But for the most part, your dog will do very well with an FHO procedure, despite how barbaric it sounds. And I do believe they do that in pediatric medicine in people. I think that if you are, and somebody can, of course, correct me if I'm wrong, those children that are born, well, when a child is born, a doctor looks for diseases that they are born with, and hip dysplasia is one of them. And I think that an FHO is what they'll do to alleviate the pain and formation of arthritis when you're very, very young. I think with the hopes of you receiving a total hip replacement when you become of age. The total hip replacement is a huge procedure. And so I imagine you couldn't perform it in very, very young children. But that being said, FHO and the total replacement can be done on any age dog, any stage of life they're in, regardless of how bad the disease is. Just a matter of what you want to do as a pet owner, how much do you want to spend, how much aftercare can you handle, can you cope with complications that can occur, can you afford whatever procedure you want to afford, and does your surgeon think that you are a candidate for both procedures? And of course, like I said, this is just two of a large number of different hip surgeries you can perform on your dysplastic dog. And of course, hip surgery will be combined with medical management, obviously. You need pain medication after surgery, you need anti-inflammatories, and of course, you still have to lose weight. You're still going to have to keep other joints healthy. You're going to need acupuncture, you're going to need physical therapy. So these are still avenues that you're going to undertake in combination with surgery. But just be aware that there are some cases where you can go just medical management route alone, or you'll pursue surgery, in which case medical management will be combined with surgery. A very detailed discussion, clear communication with your veterinarian is required before you make a decision as to what you want to do. So to recap, we went over the pathogenesis or the causes of hip dysplasia, how it affects your dog. We went through different ways of diagnosing the condition and what your veterinarian is going to recommend to diagnose it. Then, of course, we went through different treatment modalities, both surgical and non-surgical, that you can consider. I hope this podcast has informed you well. So when you go to your veterinarian with the fear that your dog has hip dysplasia, or you see the surgeon already diagnosed with hip dysplasia on your dog, that at least you have some idea what you're getting yourself into and what your options are going to be. This is a very common disease, and this discussion alone does it no justice. There are thousands. This is probably, if not the most common, the second most common orthopedic topic that's researched by veterinarians and veterinary specialists. So it's a very complex disease, and I hope this at least gives you a brief overview as far as what hip dysplasia entails. Thank you so much for listening. This is Dr. Shadi Ireifej, Chief of Specialty, part owner, and boarded surgeon at TrueCare for Pets in Studio City, Los Angeles, California. Please send any inquiries, comments, concerns, questions to TrueCare for Pets Pawcast, that's PAW, at gmail.com. Thank you so much, and we'll see you next time. Bye-bye.